Host for today. We are starting our GarbhaSandesha, the next episode of the live program with Dr. Asha S Vijay. Dr. Asha S Vijay is the founder and medical director of GarbhaGudi Group of Companies. She is a visionary in the field of infertility treatment, well known in Bangalore. Almost all of us know her very well. She is also the Dean and Scientific Director of GGIRHR, which is GarbhaGudi Institute of Reproductive Health and Research. She is the founder of the foundation, GarbhaGnan Foundation, which is involved in social activities related to infertility and education. So today we will be asking a few questions to Dr. Asha. These questions will be coming primarily from our audience who are going to participate on YouTube and Facebook Live. So the topic for today's discussion is the latest treatments in the field of infertility treatment. Okay. Okay, Dr. Asha, welcome to the program.
Thank you.
So before we start, do you want to start with a small message on COVID and infertility?
Okay, fed up of this word COVID actually. And we covered a lot last week on COVID also. And the heartening thing is the numbers of COVID infections is falling drastically all over India and especially in Bangalore urban. And what we have seen from the whole of the statistics is most of them are recovering well. And the infection in the pregnant ladies is not found to cause so much of a complication in the fetus or the pregnant mother, except in few studies we saw it was resulting in preterm labor. Otherwise, most of them are recovering well. And Government of India is yet to launch the vaccination drive to our pregnant ladies. And it is being allowed for lactating mothers and breastfeeding mothers. So probably in few weeks, they'll open it to pregnant ladies too. Vaccination is a must for everybody. There are so many confusion and myths regarding this vaccination drive, which is usually false news spread in the social media and other medias. But I want to tell you that the statistics shows most of them who are vaccinated have gone through this COVID infection in a very, very milder form. And the case fatality and casualties are very, very less in these vaccinated people. So actually vaccination is needed for everybody. Please don't have this hearsay and false facts about vaccination and avoid it. Just take a decision, thinking the pros and cons of it. And whatever I have found it's very, very useful for the larger population.
Okay, thank you. Thank you, Dr. Asha. So we'll get on to the topic that we have planned for today. So Dr. Asha, there are so many things happening in the field of medical science, right? A lot of advances coming up. So what are some latest techniques and treatment options that are available in the field of infertility today in India?
Actually, this will take 60 minutes, sir.
No, just list them. We'll get into each one of them.
There is a huge advances happening in the field of fertility. And in fact, this word infertility can be wiped out because of all these advances in this fertility field. But I feel there is no awareness among the population about these advanced techniques. Because whenever I see people, when they come to me, even though they're educated, they are not so aware of the advanced facilities available in this field. They would have spent 5 years, 10 years with longing for having a baby, but they don't know where to go, how to approach, what is the procedure to adopt. So this awareness is very, very essential. And this GarbhaSandesha platform, what we are doing, I think it's a fantastic platform to create this awareness.
Okay.
And well, I've been speaking about this, the 3 A's, which usually people don't take fertility treatment because of lack of awareness is one. The other one is accessibility to the services. And the third is affordability. They have so many misconceptions about this affordable infertility treatment that they never approach a fertility specialist when it is needed. And they waste a lot of time going through some other very less effective procedures, which is very cheap, which does not have a much success rate, or they go to different temples, do different homas, or do different religious rituals. Actually, they have to do both. Go to the temples, pray, and as well as go to a fertility specialist, take the proper treatment too. So there are many advanced techniques, both in the form of IUI or in the form of testing their semen sample through computerized analysis. Because I see so many people going to the local lab where there is not much facility, getting the semen analysis done by an unskilled person, and the report will be entirely wrong, and the people will get shattered by seeing those reports. Because I see they give 20 million count also, but in the end they would have written azoospermia or oligospermia because he's not at all trained. Instead, if you go to the best lab and get your computerized analysis, you'll get the perfect report, and the doctor sitting there and the counselor sitting there will give you the correct idea what to do next and how to get the baby easily. And there are so many procedures. Even if no sperm is found in the semen sample, there are PISA, TISA to retrieve the sperms. Even if the DNA fragmentation index is very high, we can do many sperm procedures, semen wash procedures like MAX, ICSI, PICSI. There are many techniques to help the couple conceive. Okay. We can go in a systematic manner one by one instead of telling everything and confusing everybody.
While we address the questions, Dr. Asha, there are also questions coming from our audience.
Yeah.
So we'll mix the questions coming in from the audience along with some of the questions on the advanced techniques. Yeah. Okay. So there's one question from Mr. Sarvana Meena. If a person is physically handicapped, okay, is it okay for the couple to go through IVF?
Lady or the man?
Can be either of them.
Actually, physical handicapped is a very general term. What is the handicap? Whether it involves the pelvic region?
No, let's take the example of blindness or something like that. Okay, yeah. Let's say.
Okay, I have seen many couples, yeah, like this. Yeah, I saw one couple recently. The man was blind and the lady was deaf and dumb. Okay. Actually, they wanted to conceive and they approached us. We did all the investigations and they were completely normal with respect to the fertility field. Okay. And with just simple IUI, they conceived the first month itself. Now she has already delivered.
Okay, so, but will not the handicap, whatever is the challenge they have physically, will it not get transmitted to the children?
Yeah, that's the worry they always have. So we have a genetic specialist who will do a proper counseling, taking the whole of the family tree into account, who are all suffering, what are the physical handicaps in the family, any congenital anomalies, any repeated abortions, entire thing will be charted out. And the genetic specialist will give you the proper guidance, what to do next.
Okay, super. That's nice. Okay, coming to advanced treatment, Dr. Asha, we hear a lot about PGS, PGDs.
Yeah.
So, can you throw a little bit of light on PGS and PGD, please?
Pre-implantation genetics diagnosis and screening. See, initially what was happening was after the lady conceives, either by doing amniocentesis or a chorionic villi biopsy, they used to check the fetal karyotype and the chromosomal complement and say whether the baby is suffering from something, and the lady had to undergo so much of trauma in getting the baby aborted, though it was happening at 12 to 14 weeks. But even then, you can understand what the lady will go through when the doctor advises her abortion because of congenital anomalies and chromosomal problems, isn't it?
Yes.
So it was a very good thing that we got this pre-implantation genetic diagnosis in people who have already had a baby who has some congenital anomalies or chromosomal issues. They want to know whether this baby, what they will conceive now, will it be normal? Okay. So there we advise them to go for an embryo biopsy, culture the embryo till blastocyst stage, take few cells from the blastocyst and culture it and find out the genetic analysis and tell them whether the baby is normal or whether it is an abnormal baby, even before putting it into the uterus of the lady.
Okay.
So the lady will know whatever she's conceiving is a proper normal euploid embryo rather than an aneuploid embryo. Okay. Some people you might know that repeatedly they'll be having IVF failures, implantation failures. That could be because of the genetic reasons where the embryo is not properly, it's not having a proper euploid complement and it is getting aborted because of the genetic issues. Even for those ladies, we offer this PGS, PGD. And we check the chromosomal complement of the embryo. Then whichever the embryo has a proper genetic makeup, only those embryos we transfer it into the uterus.
Okay.
So she'll be sure of carrying a healthy baby and carrying up to term also.
Okay. sickle cell disease is one of the.
Yeah, thalassemia, sickle cell.
So-
You might be hearing this boys. After few years, they start having this muscular issues,
Yeah.
and their milestones will be delayed. And the boy who was absolutely able to stand up and walk, suddenly he cripples, he crawls, and everything. All the muscles start failing. Muscular dystrophies.
Mhm.
Even all those things can be found out by this embryo biopsies, and we can help the couple have a proper normal pregnancy.
Okay, that's nice. Okay, we'll take one more question from the audience, Asha. It's a generic question from Saira Mania.
Hmm.
Can you briefly explain what is IUI and what are the advanced treatment options if available in IUI?
Intrauterine insemination
Yes.
is what she's asking.
Yes. Yeah.
Yeah, in some couples, even after having a normal sexual contact, even if the lady with the normal periods, they'll be not conceiving on their own.
Okay.
So such couples, when they come to the fertility specialist and their age is quite less,
Okay.
both of them within 30, they're quite young and they're having normal ovulation, but they're not able to conceive on their own. The first treatment we offer in such a couple is go for a ovulation induction drugs, monitor the ovulation, and whenever the egg is about to rupture, we take the sample of the husband, we process it, prepare it, and we remove all the dead materials, dead cells, immature cells, and take the best part of the sample and we inject into the uterus in a very, very painless way.
Okay.
And within 5-10 minutes, they can resume their activities. No need of any bed rest or no need of any prolonged procedure in the hospital or no need of anesthesia. Simple procedure can be done easily in any clinics.
Okay.
But only thing we should be careful is the person who is preparing the semen sample should have a basic idea what is that he is doing. He should have a lot of skill in preparing the best sample so that the success rate depends upon the prepared sample also.
Okay.
So I've seen many cases where they go to somewhere outside labs, which is not maintained in a good condition, where there is no quality control, quality assurance, and even the lab technician does not know much about the semen preparation. They go there, give the sample, wait for hours for that to be done, then carry the sample from there to the clinic where the gynecologist will do the insemination.
Okay.
So that proper chain is not maintained, the temperature control. And even when they come back to the hospital, the doctor will be very busy in her other practice or other OT procedures, and the sample will be lying there. And after many hours of the preparation, it gets injected into the uterus. Such cases will not get good success rates at all. As it is, IUI has only success rate of 12 to 15%, depending on the couple's history and the hormonal analysis. So if we do all these mistakes in between, not going to a proper lab, not getting inseminated in the right time, all this will compromise our success rates.
Okay.
So it should be done, the semen procedure should be done according to the semen analysis of the husband. So if the husband count is very normal, they just do a swimmer procedure. If there is compromised count and motility, they go for a density gradient method. Nowadays, we are having an even more best method called magnetic cell sorter.
Okay.
So we have seen many IUI success rate with MAX.
Okay.
So it's a specialized chamber where we get the best sperm sample because of the magnetic biodegradable magnets which is put inside. It takes away all the dead cells and the apoptotic sperm cells, gives us the best sample, and it gives a very good results because it fertilizes very well the oocyte.
Okay, so MAX can be used with IUI also.
Exactly, we have done that.
Okay.
And many people, as you have seen, they would have failed multiple IUIs. So when we check the semen analysis through CASA, that is computerized analysis, we find that their DFI is very high.
What is DFA?
DNA fragmentation index. That is the DNA damage of the sperm.
Okay.
So this depends directly to the condition of the man. Like for example, a diabetic or a person who is smoking since many years, or he's having alcoholic addiction, or he's into some other drugs like marijuana and other tobacco chewing. So all this will have a direct impact on the sperm cell damage, DNA fragmentation. Because the DFI is very high, they'll not be having good success rate with their IUIs.
Okay.
So we check their DFIs and we find out why the DFI is very high. For example, you might have heard of the condition called varicocele.
Yes.
Where the veins would have been swollen inside the scrotal area and the temperature would have increased in the scrotum. So the sperms, whichever is getting ejaculated, does not have a good morphology and good motility. So maybe he might require a varicocele correction, or if he consults an andrologist, he'll tell you what are the methods he can decrease the DFI by taking proper lifestyle changes or antioxidant therapies for 90 days, then giving back again one more sample. So we address high DFI by many advanced techniques and give them good success rates also.
So before we take up more questions from the audience, I just want to remind the audience, you can post your questions on either YouTube or Facebook comments area. And if we are unable to answer your questions during the time frame available, please mail your questions to dreams@garbhagudi.com. We will certainly respond to that. If you can send us your reports also along with your question, it will help us give you a proper advice. Dr. Asha will certainly advise all of you. Okay, we will take up as many questions as possible in the session today. Dr. Asha, we hear a lot about sequential transfer at GarbhaGudi and that it is giving extraordinary success rates. Can you please throw a little light on what is sequential transfer? Who needs it?
Actually, for the question which Saira somebody asked,
yes,
I wanted to add one point here.
Yeah, yes, ma'am.
People would have been trying IUIs without having done their tubal patency properly.
HSG.
Yeah, they would have done one HSG film, which is very badly done. That X-ray is not at all delineated the tubes. And the radiologist or somebody would have given it as patent tubes.
We just received a question saying, what is HSG? Why is it needed?
Yeah, see that.
Okay.
Many a times.
Shruti.
Okay. Yeah. Many a times I see the HSG films and I feel this is not the person for IUI. We could have given her more success rates with IVF.
Okay.
But they would have wasted lot of years, lot of money, time, energy, going through 6 to 8 IUIs.
Okay. Without validating the tubes.
Exactly.
Okay.
So without patent tubes, healthy tubes, functioning tubes, IUI will not be successful at all.
Okay.
So I always advise such people to go for a proper laparoscopic assessment of their pelvis.
Okay.
So that is the gold standard for assessment of the tubal patency.
Okay.
So when they have the laparoscopy, we'll know how our tubes are functioning, how the pelvis is, whether there is severe adhesions inside, or is there any polyps and fibroids is there inside which is preventing a success, or is the tube and ovaries having a normal anatomy, or is it completely distorted? We get variety of information from this proper laparoscopy. Okay. And I see couples have this hesitancy to go to laparoscopic surgeries, thinking that it is invasive. Why should we go for it? Why not? We can postpone for a few more months. But it is actually postponing their completion of family still more. So laparoscopy is the gold standard for people who want to know the perfect condition of the pelvis and the patency of the tubes. You were asking me about
sequential. I asked about sequential transfer.
Yeah. Yes, we have had a very good success rates in GarbhaGudi with respect to sequential transfers. See, once the IVF is done and the embryos are created, the embryologist will culture it to up to day 3 or day 5 embryos and then freeze it. Or the doctor might decide that we'll go for a fresh transfer of day 3 embryos. Okay. I've seen many couples who have undergone multiple IVFs, multiple frozen embryo transfers. They fail repeatedly sometimes because they've had 1 day 3 transfer, 2 day 3 transfers like that. So when they come here, we advise them this sequential transfer. That is, we culture the embryos to day 3, transfer 1 embryo of day 3, then keep it for an extended culture for day 5, and it forms a very good blastocyst. And that is the last stage of embryos which can happen in vitro. So then we see the grade of the blastocyst and we put 1 more blastocyst into the uterus, day 3 and day 5. That is called sequential.
Two embryos are transferred on different days.
Exactly. 2 embryo transfers happen. There is one risk here about multiple pregnancy.
There's a question on multiple pregnancy also, ma'am. I just asked so that you can address the same also along with that. Why twin babies are born with IVF treatment and why are usually the girl child is seen in IVF?
Nothing like that. I've seen many boys twins.
Yeah, you were talking about multiple pregnancies.
Yeah.
Sequential.
Sequential transfer, because we transfer 2 embryos or 3 embryos, there are chances of multiple pregnancy happening in sequential. But the success rate is very huge compared to day 3 alone or day 5 alone.
Okay.
See, when you opt for only day 5, when you keep all the embryos to culture up to day 5, many a times, more than 30-40% of times, no blastocyst forms.
Okay.
So we may end up in no transferring of any embryos, and the whole cycle goes a waste.
Okay.
So if you have transferred one day 3, at least that couple has a chance of conceiving. That is one thing. And the person who is asking us, Shruti, I think, why multiple pregnancies is common, because we transfer 2 or 3 embryos. Usually we don't transfer 3 now. We have taken a stand that we'll only transfer 2. Most of the advanced countries have come to SCT, only single embryo transfers. And I see many couples who come to us, they say that they don't want multiple pregnancy, they want only single pregnancy, and they want only single embryo transfer. It's the wish of the couples also. Because we transfer multiple embryos, the incidence of multiple pregnancies is more. But regarding the sex of the fetus, that is not a fact.
Ma'am, there are quite a few questions that are coming up. So let's address a few questions quickly and then go back to the main topic of today's session. So question from Sumati Venkatesha. My age is 34 and I'm married for 4 years with severe PCOS. Cycles only on medication. I've undergone 3 cycles of ovulation induction with no success. Husband parameters are all normal. Need your advice on what is the next step that I need to do. Also, can I go ahead with second dose of vaccination?
She has taken her first dose.
Yes.
Yeah, definitely she should take it.
Okay.
As prescribed for Covaxin and Covishield. There's a time gap, isn't it?
Yes.
She has to follow it.
So vaccination has to be taken, Mrs. Sumati Venkatesha.
Yeah.
Coming to the question on her PCOS and 3 cycles of OI.
Ovulation induction.
Yes.
We don't know what was the drug given, what was the dose given.
Yes.
That is one thing. And she's telling she's a severe PCOS. I don't know her BMI, because BMI, ovulation induction, and the dosage of drugs, everything is related linearly. So I need to know what is the dosage given, days of this ovulation induction drugs given, and where did she take the treatment, and what is her BMI. So there are many options for her to ovulate when one drug does not help. For example, if clomiphene citrate was used to her in a dose of 100 mg, then we shift to letrozole along with HMG and also recombinant FSH. I have seen many people who have not ovulated with ovulation induction drugs ovulate with gonadotrophins, especially recombinant FSH works wonders. We have to just tailor it very well to her according to her BMI, monitor her very well, and severe PCOS is not a stumbling block for her to conceive if she keeps her BMI properly. Normal BMI should be within 25. We have to check hers and advise her good lifestyle modifications. And there are many options nowadays in the form of myoinositol, chiroinositols, metformins, which will really give her an edge for conception and for having ovulation properly. And because her husband is normal, she has a very good chance of conceiving with proper monitoring.
Okay. So the message, I'll just summarize, Dr. Asha. PCOS is easily manageable. Keep your BMI under control and get advice from the right doctor with all your reports. So that should be able to give you clarity on what are the next steps.
Where does she stay?
We have that information.
We can have a teleconsultation with her.
Yeah, GarbhaGudi is offering teleconsultation with our specialist doctors. Please reach out to GarbhaGudi either on the website or on the mobile number displayed, and we can arrange teleconsultations with our specialists.
I can talk to her if it's.
Yeah. Now, next question. Some questions we'll finish off quickly. We have about 25 questions lined up already. Sagar Mutalik, trying to have a baby from 5 years. 3 years back, my wife had concern that she had a miscarriage because there was no heartbeat, and she's also suffering from irregular periods. Age is 28 and 30. Okay, so what is it that they have to do next? Sagar Mutalik.
Okay, the baby got aborted because lack of heartbeat.
Lack of heartbeat.
That could be because that's an embryonic gestation. We have to check her ultrasound whether she's having polycystic disease, and also her thyroid profile, because that also causes embryonic gestation. And they're married for 5 years, and his semen analysis is normal.
We don't have that, but we can assume it is normal.
Okay, but what is the time period after the last abortion?
3 years back it was there.
So they are not able to conceive in this
Yeah,
3
they have
years.
not been able to conceive.
We have to look for all her investigations actually.
Okay.
First was an embryonic gestation, and then there is a secondary infertility.
Mhm.
There will be some reasons there. So
Okay.
if you go through all her hormone analysis, his blood sugar levels, his semen analysis, everything, we can pinpoint one cause for that and treat it accordingly rather than speculate everything.
Okay.
So if you can send all the reports to Dreams at Garbhagudi,
Yes.
I can go through and really advise them properly.
Mr. Sagar Mutalik, please send your reports on email or contact our call center and send us the reports. We'll be able to give you an advice based on the reports that you send. Chandra Mohan, we got 3 A-grade embryos in an IVF cycle. Is it customary, mandatory to transfer all embryos at the same time?
No, sir, not at all. 3 grade A embryos. So the doctor will decide depending on the endometrial thickness, your age, and your fertility history, what she has taken, whether to transfer 1, 2, or all 3. It's not a this one. All 3 embryos should be transferred. It is not a
It's not
norm.
mandatory.
Yeah, it's not mandatory.
Question from Mercy Rekha. Severe PCOS since 10 years. Irregular periods. Age is 33. 2 times DNC. No heartbeat for baby miscarriage. So can I go ahead with IUI procedure? Husband is 36 years.
She's 33.
She's 33. Husband is 36. 2 times DNC. No heartbeat. Can she go for IUI?
Is it consanguineous? Nothing is written, no?
No, ma'am, we don't have that information. 33 is slightly on the higher side.
Yeah. 33 is a bit higher side, and husband is 35.
36.
36. His semen is normal.
Yes.
So all these were natural conception, I
Yes.
presume.
Yes.
Okay, but you have to find out why there is lack of cardiac activity in the fetus twice, and she has undergone surgical evacuation also.
Mhm.
So she better approach a fertility specialist with all the thyroid reports, all her day 2 FSH LH report, and husband's reports, and find out whether it is due to severe PCOS or is there any other underlying cause which is leading to this lack of cardiac activity.
Okay.
And we'll then decide whether she has to go for IUI and what is the best method for her to prepare the sample and inject her.
Okay.
Or does she need any other advanced techniques? And whether genetic analysis of the couple is necessary. There are so many things to do. They have to approach the doctor. If she's in Bangalore, she can have an appointment with me.
Okay. Okay. So, Mrs. Mercy Rekha, the summary is we need a little more information about your situation. Please send us the reports and we'll be able to advise you. If possible, please get a consultation with our specialists.
Actually, her doubt is whether if she goes for an IUI, whether it will lead her to successful pregnancy.
Yes.
And whether it carries to term. Actually, it's not like that. There is some other underlying issue there, which will not be solved with only IUI.
Okay.
So we have to do a lot of groundwork and then plan her for an advanced procedure.
Okay. We'll come back to one of the advanced treatment questions, ma'am, and then go back to the questions from the couples. What is endometrial regeneration? We hear so much about PRP and GAPC and all that.
Correct.
What is endometrial regeneration? Who needs it? Does everybody need it? Can you please explain?
Very important question. I know one couple, they used to come from somewhere near Hosur, and they had undergone an IVF there at Hosur Fertility Center, and they had created the embryos. 24 months, she did not get her endometrium properly.
24
2 years they have postponed, giving her repeated hormonal replacement therapy, calling her again, putting her on OC pills, again putting on hormonal replacement. Endometrium had never come to a proper dimension for them to transfer. So that couple had got completely distraught and they had approached us. And what we did here was found out that whether she had any infection lurking inside the uterus, which is preventing her endometrium to grow like tuberculosis. All her biopsies were negative for tuberculosis and other infections. And then the other hormone analysis, everything was perfect. but that lady was not getting a good triple line endometrium with good blood flow. So we had to start her on endometrium regeneration, give her granulocyte stimulating factor GCSF injections into the uterus, and also put the bioactive peptide concentrate, which is prepared from the patient's blood itself. We take the platelet concentrate and then prepare it, and we had to inject it inside thrice in one cycle, and the endometrium grew up to 7. That was the maximum she was getting. And then we transferred her through sequential day 3 and day 5, and she conceived. So there are many patients who, because of some unknown causes, they don't get the proper endometrial growth, which should grow alongside the egg. So as the follicle is growing, even the endometrium lining should grow because of the hormone secreted from the ovaries. But some people, as in case of a polycystic ovarian disease, the follicle keeps growing, but the endometrium never grows. Or in some people, when they are using inadvertent doses of clomiphene citrate, only the follicle starts expanding, but the endometrium never grows. The clomiphene has some side effects regarding the endometrial growth, which is anti-estrogenic effect, but it forms the very good follicle. But it is of a waste because the follicle ruptures and the embryo has to finally come and sit inside the uterus to implant, isn't it? And some people will have inside pelvic infections or uterine infections, chronic endometritis, which does not enable the endometrium to grow properly. So in those cases, we put a proper HRT, hormone replacement therapy, monitor them, and then also inject granulocyte colony stimulating factor and also bioactive peptide concentrate. There are many approaches towards it. Also, we have vaginal tablet sildenafil, which will help the blood flow to increase. There are many methods to regenerate the endometrium. So by those methods, we can really help for the implantation of the embryos.
There's one person who's asking some questions. Please answer in Kannada, so that few others can understand. Question from Sneha Bharat. Is actually a couple of the questions we have received in the same sort of problem. Most of them treatment shuru madidare. Madi, investigations agide, the basic procedures agide. Lockdown ಆಗಿದ್ರಿಂದ ಎಲ್ಲ ನಿಲ್ಲಿಸಿದ್ದಾರೆ. ಈಗ ಏನ್ ಮಾಡಬೇಕು, ಯಾವಾಗಿಂದ ಶುರು ಮಾಡಬೇಕು, ಈಗ ಕಂಟಿನ್ಯೂ ಮಾಡಬೇಕಾ, ಕೋವಿಡ್ ಇರೋದ್ರಿಂದ ಏನಾದ್ರು ಇದು ತಡ ಮಾಡಬೇಕಾ ಅನ್ನೋ ಪ್ರಶ್ನೆ 3-4 ಜನ ಕೇಳಿದ್ದಾರೆ.
ತುಂಬಾ ಜನಕ್ಕೆ ಡೌಟ್ ಇದೆ ಆಕ್ಚುಲಿ. ಎಲ್ಲರೂ ಬಂದು ಇನಿಷಿಯಲ್ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ಸ್ ಎಲ್ಲ ಮಾಡಿಸ್ಕೊಂಡಿದ್ರು, ಬಟ್ ಆಮೇಲೆ ನಾವು ಅವ್ರಿಗೆ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿ ಹೇಳಿದ್ವಿ ಅಥವಾ IVF ಹೋಗ್ಬೇಕು, ನೀವು IUI ಮಾಡಿಸ್ಬೇಕು ಅಂದ ತಕ್ಷಣ ಅದು ಲಾಕ್ ಡೌನ್ ಆಗೋಯ್ತು. ಸೊ ಅವ್ರಿಗೆಲ್ಲ ಫುಲ್ ಕನ್ಫ್ಯೂಷನ್ ಆಗ್ಬಿಟ್ಟು ಮನೇಲಿದ್ರು. ಬಟ್ ಇವಾಗ ಒಬ್ಬೊಬ್ರಿಗೆ ಏನಾಗುತ್ತೆ ಅಂತಂದ್ರೆ ಓವೇರಿಯನ್ ರಿಸರ್ವ್ ತುಂಬಾ ಕಮ್ಮಿ ಇರುತ್ತೆ. ಸೊ ಅಂತವ್ರಿಗೆ ಈ ಲಾಕ್ ಡೌನ್ ಎಲ್ಲ ಅರ್ಥ ಆಗಲ್ಲ ಓವರೀಸ್ಗೆ. ಸೊ ಅದು ಕಮ್ಮಿ ಆಗ್ತಾ ಇರುತ್ತೆ ರಿಸರ್ವ್ಸ್, ಅಥವಾ ಸೆಮೆನ್ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ತುಂಬಾ ಕಮ್ಮಿ ಇರುತ್ತೆ ಸ್ವಲ್ಪ ಜನಕ್ಕೆ. ಸೊ ಅವ್ರಿಗೆ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಬಂದು ಮಾಡಿಸ್ಕೊಳ್ಳಿ ಅಂತೆಲ್ಲ ಹೇಳಿರ್ತೀವಿ ನಾವು. ಸೊ ಅಂತವ್ರು ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಮೂಲಕ ಡಾಕ್ಟರ್ಸ್ ನ ಮೀಟ್ ಮಾಡಿ ಆನ್ಲೈನ್ ಡಿಸ್ಕಸ್ ಮಾಡಿ ಯಾವಾಗ ಬರ್ಬೇಕು ಅಂತ ಕರೆಕ್ಟ್ ಆಗಿ ಡಾಕ್ಟರ್ಸ್ ಹೇಳ್ತಾರೆ. ನೀವು ನೆಕ್ಸ್ಟ್ ಪೀರಿಯಡ್ ಡೇಟು ಬಂದ್ಬಿಡಿ, ಡಿಲೇ ಮಾಡಬೇಡಿ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇವತ್ತೊಂದು ಲೇಡಿ ಬಂದಿದ್ದಾರೆ, ಅವ್ರ ರಿಸರ್ವ್ ತುಂಬಾ ಕಮ್ಮಿ ಇತ್ತು. ನಾನ್ ಬೆಳಗ್ಗೆ ನೋಡಿದ್ದು 3+3 ಇತ್ತು, 30 ಏಜ್.
3+3 ಅಂದ್ರೆ
ಆಂಟ್ರಲ್ ಫಾಲಿಕ್ಯುಲರ್ ಕೌಂಟ್. ಅದು ಎಗ್ಸ್ ಎಷ್ಟಿದೆ ಅಂತ ನಾವು ಡೇ 2 ಡೇ 3 ಕೌಂಟ್ ಮಾಡ್ತೀವಿ. ಸೊ ಅದು ಯೂಶಲಿ 5 to 7 ಇದ್ರೆ ಐಡಿಯಲ್. ಇನ್ನೂ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಅಪ್ 10 ವರೆಗೂ ಇರುತ್ತೆ ಒಬ್ಬೊಬ್ರಿಗೆ. ಸೊ ಈ ಲೇಡಿಗೆ ಬರೀ 3+3 ನಾವು ಲಾಕ್ ಡೌನ್ ಮುಂಚೆ ಹೇಳಿದ್ವಿ, ಅವ್ರು ಬರಕ್ಕೆ ಆಗ್ಲಿಲ್ಲ ಪಾಪ. ಬಟ್ ಇವತ್ತೆಲ್ಲ ಪರ್ಮಿಷನ್ ತಗೊಂಡು ಲೆಟರ್ ಎಲ್ಲ ತೋರಿಸಿ ನಮ್ದು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಎಲ್ಲ ತೋರಿಸಿ ಕೇಳ್ಕೊಂಡು ಬಂದಿದ್ರು. ಸೊ ಅವ್ರಿಗೆ ಇಮಿಡಿಯೇಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೇಕು. ವಿ ಕೆನಾಟ್ ವೇಟ್. 1+1 ಆಗ್ಬಿಟ್ರೆ ಆಮೇಲೆ ಅವ್ರಿಗೆ ಏನು ರಿಸಲ್ಟು ಬರಲ್ಲ. ಆಮೇಲೆ ಆ ದುಡ್ಡೆಲ್ಲ ದಂಡ ಆಗುತ್ತೆ, ಅವ್ರ ಟೈಮ್ ಅಂಡ್ ಎನರ್ಜಿ ಪಾಪ ವೇಸ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಅವ್ರಿಗೆ ಹೇಳ್ಬಿಟ್ಟು ಕೌನ್ಸಿಲ್ ಮಾಡ್ಬಿಟ್ಟು ಇವತ್ತು ಶುರು ಮಾಡಿದ್ವಿ. ಸೊ ಒಂದು ಕಪಲ್ದು ಹೇಗಿದೆ ಅವ್ರದ್ದು ಪ್ರೊಫೈಲ್ ನೋಡ್ಕೊಂಡು ನಾವು ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಮೂಲಕನೇ ಅವ್ರಿಗೆ ಹೇಳ್ತೀವಿ, ಯು ಹ್ಯಾವ್ ಟು ಸ್ಟಾರ್ಟ್ ಇಮಿಡಿಯೇಟ್ಲಿ. ಇಲ್ಲ ನೀವು ವೇಟ್ ಮಾಡ್ಬೋದು, ನಿಮ್ ಡಯಾಬಿಟಿಸ್ ಕಂಟ್ರೋಲ್ ಇಲ್ಲ, ಸೊ ನಿಮ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಟೇಕ್ ಎ ಗ್ಯಾಪ್ ಆಫ್ 3 months, ವ್ಯಾಕ್ಸಿನೇಟ್ ಆಗಿ ಬನ್ನಿ. ಒಬ್ಬೊಬ್ರಿಗೂ ಒಂದೊಂದು ಅಡ್ವೈಸ್ ಇರುತ್ತೆ. ಇದು ಬ್ಲಾಂಕೆಟ್ ಆಗಿ ನಾನು ಹೇಳಕ್ ಆಗಲ್ಲ. ಎಕ್ಸಾಕ್ಟ್ಲಿ. ಸೊ ಅವ್ರದ್ದು ನೋಡ್ಕೊಂಡು ಹಿಸ್ಟ್ರಿ ನಾವು ನೀಟಾಗಿ ಅಡ್ವೈಸ್ ಮಾಡ್ತೀವಿ. ಬರ್ಬೇಕು ಅನ್ನೋರ್ಗೆ ನಾವು ಲೆಟರ್ ಕೊಡ್ತೀವಿ. ಸೊ ಅದು ತೋರಿಸ್ಕೊಂಡು ಅವ್ರು ಪೊಲೀಸ್ ಹತ್ರ ಪರ್ಮಿಷನ್ ತಗೊಂಡು ಬರ್ಬೋದು.
ಮತ್ತೆ ಮಲ್ಟಿಪಲ್ ಕ್ವೆಶ್ಚನ್ಸ್ ಬರ್ತಾ ಇರೋದು ಮ್ಯಾಮ್, ಅದೇ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಆಗಿದ್ವಿ, ಅಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಇರ್ಬೋದು ಅಥವಾ ಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಇರ್ಬೋದು, ಹಾಸ್ಪಿಟಲ್ ಅಡ್ಮಿಟ್ ಆಗಿ ಡಿಸ್ಚಾರ್ಜ್ ಆಗಿದೆ, ಈಗ ಟ್ರೀಟ್ಮೆಂಟ್ ಶುರು ಮಾಡ್ಲಿಕ್ಕೆ ಗ್ಯಾಪ್ ಕೊಡ್ಬೇಕಾ, ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಶುರು ಮಾಡ್ಬೋದಾ, ಅದು ಒಂದು. ಜೊತೆಗೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಳ್ಳೋದ್ರದ್ದು ಇದ್ರ ಜೊತೆಗೆ ತುಂಬಾ ಜನ ಕನ್ಫ್ಯೂಷನ್ ಇದೆ. ನೀವು 3 ಸಲ ಆನ್ಸರ್ ಮಾಡಿದೀರಾ ಲಾಸ್ಟ್ ಪ್ರೋಗ್ರಾಮ್, ಈ ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ದಯವಿಟ್ಟು ಇನ್ನೊಂದ್ಸಲಿ ಅದು ರಿಪೀಟ್ ಮಾಡ್ಬಿಡಿ, ತುಂಬಾ ಕ್ವಶನ್ಸ್ ಅದ್ರ ಬಗ್ಗೆ ಬರ್ತದೆ.
ಅದೇ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಇದ್ದಾಗ ಅವ್ರು ಯಾವ ಕೋರ್ಸ್ ಆಫ್ ಇಲ್ನೆಸ್ ಅಲ್ಲಿ ದೇ ಹ್ಯಾಡ್ ಟು ಗೋ ಥ್ರೂ,
ಅಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಅಂತ,
ಎಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಅಂತಿದ್ರೆ ದೇರ್ ಇಸ್ ನಥಿಂಗ್ ಟು ವರಿ. ಸೊ ಈಗ ಕಂಪ್ಲೀಟ್ ಅವರು ನಾರ್ಮಲ್ ಬಂದ್ಬಿಟ್ಟಿರ್ತಾರೆ. ಸೊ ನೆಕ್ಸ್ಟ್ ಪೀರಿಯಡ್ ಇಂದಾನೆ ಅವ್ರು ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಕೋಬಹುದು. ವ್ಯಾಕ್ಸಿನೇಷನ್ ಹಾಕಿಸ್ಕೊಳ್ಳೋದು ಮಸ್ಟ್. ಅದ್ ಹಾಕಿದ್ಮೇಲೆ 4 weeks ಗ್ಯಾಪ್ ತಗೊಂಡು ದೇ ಕ್ಯಾನ್ ಸ್ಟಾರ್ಟ್ ದೇರ್ ಫರ್ಟಿಲಿಟಿ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್.
ಈಗ ಪಿಕಪ್ ಆಗೋಗಿ ಎಂಬ್ರಿಯೋಸ್ ರೆಡಿ ಇರೋರು ಏನ್ ಮಾಡ್ಬೇಕು? ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಂಡು ಈ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಬರ್ಬೇಕಾ?
ಹೌದೌದು, ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಂಡು ಗ್ಯಾಪ್ ಆಫ್ 4 weeks ಬಿಟ್ಟು ನೆಕ್ಸ್ಟ್ ಸೈಕಲ್ ಅಲ್ಲಿ ಡೇ 2 ಬಂದು ಹಾರ್ಮೋನ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಥೆರಪಿ ತಗೊಂಡು ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿಸ್ಕೋಬೇಕು.
ಸೊ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಮಾತ್ರ ತಗೊಳ್ಳೇಬೇಕು, ಯಾವುದೇ ಸಂದರ್ಭದಲ್ಲಿ ಯೋಚನೆ ಮಾಡಬೇಡಿ, ದಯವಿಟ್ಟು ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಳ್ಳಿ. ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಂಡ ಮೇಲೆ 3 ವಾರದಿಂದ 4 ವಾರ ಬಿಟ್ಟು ಟ್ರೀಟ್ಮೆಂಟ್ ಕಂಟಿನ್ಯೂ ಮಾಡಿ.
ಹೌದು,
ಕರೆಕ್ಟ್ ಅಲ್ಲ ಮೇಡಮ್?
ಹೌದು. ಅಕಸ್ಮಾತ್ ಅವ್ರು ಎಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಇರ್ಲಿಲ್ಲ, ಸಿವಿಯರ್ ಇಲ್ನೆಸ್ ಆಗಿತ್ತು, ಹೌದು, ಲಂಗ್ ಎಲ್ಲ ತುಂಬಾ ಇನ್ಫೆಕ್ಟ್ ಆಗಿತ್ತು, CRP ಎಲ್ಲ ತುಂಬಾ ಹೈ ಇತ್ತು, ಡಾಕ್ಟರ್ಸ್ ಎಲ್ಲ ಅಡ್ವೈಸ್ ಮಾಡಿದ್ರು ತುಂಬಾ ದಿವಸ ರೆಸ್ಟ್ ಬೇಕು ಅಂತೆಲ್ಲ ಇದ್ರೆ, ಅವ್ರದ್ದು ನೆಕ್ಸ್ಟ್ ಫಿಸಿಷಿಯನ್ ಅಡ್ವೈಸ್ ತಗೊಂಡು ಲಂಗ್ ಫಂಕ್ಷನ್ ಎಲ್ಲ ಹೇಗಾಗಿದೆ, ಬ್ಲಡ್ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಎಲ್ಲ ಕೋವಿಡ್ ರಿಲೇಟೆಡ್ ಬ್ಲಡ್ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಇದೆಯಲ್ಲ ಅದೆಲ್ಲ ನಾರ್ಮಲ್ ಬೇಸ್ ಲೈನ್ ಬಂದಿದ್ಯಾ, ಅವ್ರು ಯಾವ ತರ ಅವ್ರದ್ದು ಡೈಲಿ ಆಕ್ಟಿವಿಟೀಸ್ ಮಾಡ್ತಿದ್ದಾರೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಾವೇ ನೋಡಿದೀವಿ ಎಷ್ಟೋ ಜನ ರಿಕವರ್ ಆದವರು 3 months ಆದ್ರೂ ಹೌ ದೇ ಆರ್ ಸ್ಟ್ರಗ್ಲಿಂಗ್ ಟು ಹ್ಯಾವ್ ದರ್ ನಾರ್ಮಲ್ ಆಕ್ಟಿವಿಟೀಸ್ ಅಂತ. ಸೊ ಅಂತವ್ರಿಗೆ ನಾವು ಕನ್ಸೀವ್ ಆಗೋದಕ್ಕೆ ಇಮಿಡಿಯೇಟ್ ಹೇಳಲ್ಲ, ಯಾಕಂದ್ರೆ ಆಸ್ ಇಟ್ ಇಸ್ ಪ್ರೆಗ್ನೆಂಟ್ ಲೇಡೀಸ್ ಅಲ್ಲಿ ಕಾರ್ಡಿಯೋವಾಸ್ಕ್ಯುಲರ್ ಚೇಂಜಸ್ ತುಂಬಾ ಇರುತ್ತೆ, ಲಂಗ್ ಅಂಡ್ ಪಲ್ಮನರಿ ಇದು. ಸೊ ಅವ್ರಿಗೆ ನೀವು ನೋಡಿರ್ಬೋದು, ನಾರ್ಮಲ್ ಪ್ರೆಗ್ನೆಂಟ್ ಲೇಡೀಸ್ ಉಸಿರಾಡೋದಕ್ಕೆಲ್ಲ ಎಷ್ಟು ತೊಂದರೆ ಪಡ್ತಾರೆ. ಎಕ್ಸಾಕ್ಟ್ಲಿ. ಸೊ ಅವ್ರು ಕರೆಕ್ಟ್ ಆಗಿ ಅವ್ರದೆಲ್ಲ ಲಂಗ್ ಫಂಕ್ಷನ್ ಎಲ್ಲ ನಾರ್ಮಲ್ ಬಂದ್ಮೇಲೆ ಫಿಸಿಷಿಯನ್ ಅಡ್ವೈಸ್ ತಗೊಂಡು ಇವಾಗ ನನ್ಗೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಬೇಡ, ಐ ಕ್ಯಾನ್ ಗೋ ಅಹೆಡ್ ವಿತ್ ಮೈ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅಂತ ನೋಡ್ಕೊಂಡು ವಾಪಸ್ ಬಂದ್ಬಿಟ್ಟು ಫರ್ಟಿಲಿಟಿ ಸ್ಪೆಷಲಿಸ್ಟ್ ನ ಮೀಟ್ ಮಾಡ್ಬೇಕು. ಆಮೇಲೆ ಅವ್ರು ಕೋವಿಡ್ ರಿಕವರಿ ಆದ್ಮೇಲೆ ಅವ್ರಿಗೆ ಟೈಮ್ ಗ್ಯಾಪ್ ಇದೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ಗೆ. ಸೊ ಅದು 3 months ಆಫ್ಟರ್ ದರ್ ಲಾಸ್ಟ್ ಸಿಂಪ್ಟಮ್ ಅಂತ ಏನೋ ಅದು ಕರೆಕ್ಟ್ ಆಗಿ ಫಿಸಿಷಿಯನ್ ಅಡ್ವೈಸ್ ತಗೊಂಡ ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೋಬೇಕು.
couple of questions around male infertility. ಅಜೂಸ್ಪರ್ಮಿಯಾ ಇದ್ರೆ ಅದಾದ್ಮೇಲೆ ಇವಾಗ ಟಿ ಸೈನ್ ಅದನ್ನ ಮಾಡಿಸಿ ಮಗು ಆದ್ರೆ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತಾ, ಮಗು ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತಾ? ಇನ್ನೊಂದು ಟೆರಟೋಅಜೂಸ್ಪರ್ಮಿಯಾ ಸಹನ ಅನ್ನೋದು ಕೇಳ್ತಿದ್ದಾರೆ, ಹಸ್ಬೆಂಡ್ ಗೆ ಟೆರಟೋಅಜೂಸ್ಪರ್ಮಿಯಾ ಇದ್ರೆ ಮಗು ಬೇಬಿ ಗ್ರೋತ್ ಗೆ ಏನಾದ್ರು ತೊಂದರೆ ಆಗುತ್ತಾ? ಈ ತರದ್ದು 3-4 ಕ್ವೆಶ್ಚನ್ ಬಂದಿದೆ. ಮೇಲ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ರಿಲೇಟೆಡ್ ವೇರಿಯಸ್ ಚಾಲೆಂಜಸ್ ಇದೆ, ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡು ಕನ್ಸೀವ್ ಆದ್ರೆ ಮಗುಗೆ ಏನಾದ್ರು ತೊಂದರೆ ಆಗುತ್ತಾ ಅನ್ನೋದು 3 ಕ್ವೆಶ್ಚನ್ ಬಂದಿದೆ.
ಓಕೆ, ಇದು ಅಜೂಸ್ಪರ್ಮಿಯಾ ಅಂತಂದ್ರೆ ದೇರ್ ಇಸ್ ಆಬ್ಸೆನ್ಸ್ ಆಫ್ ಸ್ಪರ್ಮ್ಸ್ ಇನ್ ದ ಸೆಮೆನ್ ಸ್ಯಾಂಪಲ್ ಅಂತ. ಸೊ ಅವ್ರ ಅಜೂಸ್ಪರ್ಮಿಯಾ ಅಂದ ತಕ್ಷಣ ನಾವು ಡೋನರ್ ಸ್ಯಾಂಪಲ್ ಗೆ ಹೋಗ್ಬೇಕು ಅಂತ ತುಂಬಾ ಜನ ಈ ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್ ಅಲ್ಲಿ ಇರ್ತಾರೆ.
ಟೆರಟೋಅಜೂಸ್ಪರ್ಮಿಯಾ ಬೇರೆ, ಅಜೂಸ್ಪರ್ಮಿಯಾ ಬೇರೆ.
ಟೆರಟೋಅಜೂಸ್ಪರ್ಮಿಯಾ ಅಂದ್ರೆ ಸ್ಪರ್ಮ್ ಗೆ ನಾರ್ಮಲ್ ಆಕಾರ ಇಲ್ಲ ಅಂತ, ಇಟ್ ಡಸಂಟ್ ಹ್ಯಾವ್ ಅ ನಾರ್ಮಲ್ ಮಾರ್ಫಾಲಜಿ. ಯೂಶಲಿ ಹೆಡ್, ಟೇಲು, ನೆಕ್, ಮಿಡ್ ಪೀಸ್ ಅಂತ ಇರುತ್ತಲ್ಲ, ಆಕ್ರೋಸೋಮಲ್ ಕ್ಯಾಪ್ ಅಂತ, ಅದರಲ್ಲಿ ಡಿಸ್ಟಾರ್ಷನ್ಸ್ ಇರುತ್ತೆ, ಡಿಫಾರ್ಮೇಶನ್ಸ್ ಇರುತ್ತೆ, ಅದು ಟೆರಟೋಅಜೂಸ್ಪರ್ಮಿಯಾ. ಸೊ ಅಜೂಸ್ಪರ್ಮಿಯಾ ಅಂದ್ರೆ ಕಂಪ್ಲೀಟ್ ಆಬ್ಸೆನ್ಸ್ ಆಫ್ ಸ್ಪರ್ಮ್ಸ್ ಇನ್ ದ ಸೆಮೆನ್ ಸ್ಯಾಂಪಲ್ ಅಂತ. ಸೊ ಅದ್ ಏನಕ್ಕಾಗಿದೆ ಈ ಪರ್ಸನ್ಗೆ ಅಂತ ಅನ್ಬಿಟ್ಟು ಆಂಡ್ರಾಲಜಿಸ್ಟ್ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಅನಲೈಸ್ ಮಾಡ್ತಾರೆ. ಹೌದು, ಸ್ಕ್ರೋಟಲ್ ಸ್ಕ್ಯಾನು, ಟೆಸ್ಟಿಸ್ ಹೇಗಿದೆ, ಡೆವಲಪ್ ಆಗಿದ್ಯಾ ಅಥವಾ ನಾಳಗಳು ಬ್ಲಾಕ್ ಆಗಿದ್ಯಾ, ವೆದರ್ ಇಟ್ ಇಸ್ ಡ್ಯೂ ಟು ಅಬ್ಸ್ಟ್ರಕ್ಷನ್ ಆರ್ ವೆದರ್ ಇಟ್ ಇಸ್ ಡ್ಯೂ ಟು ಪ್ರೊಡಕ್ಷನ್ ಅಂತ ನೋಡ್ಕೊಳ್ತಾರೆ ಫಸ್ಟ್. ಅವ್ರಿಗೆ ಥ್ರೂ ಟೀಸಾ ಸ್ಪರ್ಮ್ಸ್ ನ ರಿಟ್ರೀವ್ ಮಾಡ್ಬೋದಾ ಅಂತ ನಮ್ಗೆ ಆಂಡ್ರಾಲಜಿಸ್ಟ್ ಒಪಿನಿಯನ್ ಕೊಡ್ತಾರೆ. ಸೊ ಅಂತವ್ರಿಗೆ ಅವ್ರದೇ ಸ್ಪರ್ಮ್ಸ್ ಇಂದ ಮಗು ಮಾಡ್ಬೋದು. ತುಂಬಾ ಜನಕ್ಕೆ ನೋಡಿದೀವಿ, ವೆರಿ ವೆಲ್ ಇಟ್ ಗೆಟ್ಸ್ ರಿಟ್ರೀವ್ and we get very good sperms also, and many people of azoospermia have conceived with this TISA sample. ನಾನ್ ನೋಡಿರೋ ಪ್ರಕಾರ ಈ ಪ್ರೊಸೀಜರ್ ಇಂದ, ಈ IVF ಇಂದ ಮಗುಗೇನು ಪ್ರಾಬ್ಲಮ್ ಆಗಲ್ಲ. ಒನ್ಸ್ ಶಿ ಕನ್ಸೀವ್ಸ್ ಅಂಡ್ ಎವ್ರಿಥಿಂಗ್ ಗೋಸ್ ನಾರ್ಮಲ್, 9 months ವರೆಗೂ ಬೇಬಿ ಡೆವಲಪ್ಮೆಂಟ್ ಪರ್ಫೆಕ್ಟ್ ಆಗುತ್ತೆ, ಅದ್ರಲ್ಲಿ ಏನು ಕುಂದು ಕೊರತೆಗಳು ಬರಲ್ಲ, ಅಂಡ್ ಇಟ್ ಡೆಲಿವರ್ಸ್ ಅ ಹೆಲ್ತಿ ಬೇಬಿ. ಆಮೇಲೆ ಅದ್ರ ಗ್ರೋತ್, ಇಂಟೆಲಿಜೆನ್ಸ್ ಎಲ್ಲ ಪರ್ಫೆಕ್ಟ್ ಆಗಿರುತ್ತೆ, ನಥಿಂಗ್ ಟು ವರಿ ಅಟ್ ಆಲ್. ಮತ್ತೆ ಟೆರಟೋಅಜೂಸ್ಪರ್ಮಿಯಾ ಅಲ್ಲಿ ಮಾರ್ಫಾಲಜಿ ಏನಕ್ಕೆ ಆತರ ಕಮ್ಮಿ ಆಗೋಗಿದೆ ಅಂತ ಅನ್ಬಿಟ್ಟು ಚೆಕ್ ಮಾಡ್ತಾರೆ. ಇಟ್ ಕುಡ್ ಬಿ ಡ್ಯೂ ಟು ಸ್ಮೋಕಿಂಗ್. ಸ್ಮೋಕ್ ಅಲ್ಲಿ ಇದ್ರಲ್ಲಿ ಕೆಮಿಕಲ್ಸ್ ಮೋರ್ ದೆನ್ 4000 ಕೆಮಿಕಲ್ಸ್ ಇದೆಯಂತೆ, ಆಯ್ತಾ? ಸೊ ಆ ಕೆಮಿಕಲ್ಸ್ ಎಲ್ಲ ತುಂಬಾ ಬ್ಯಾಡ್ ಎಫೆಕ್ಟ್ ಇರುತ್ತೆ ಅವ್ರದ್ದು ಸ್ಪರ್ಮ್ಸ್ ಮೇಲೆ, ಮಾರ್ಫಾಲಜಿ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಡಿಸ್ಟಾರ್ಟ್ ಆಗೋಗಿರುತ್ತೆ. ಸೊ ಅಂತ ಸ್ಪರ್ಮ್ಸ್ ಮೇ ನಾಟ್ ಲೀಡ್ ಟು ಹೆಲ್ತಿ ಪ್ರೆಗ್ನೆನ್ಸೀಸ್. ಸೊ ಅಂತವ್ರಿಗೆ ದೇ ಹ್ಯಾವ್ ಟು ಗಿವ್ ಅಪ್ ಸ್ಮೋಕಿಂಗ್, ಟೇಕ್ ಪ್ರಾಪರ್ ಆಂಟಿ ಆಕ್ಸಿಡೆಂಟ್ಸ್, ತುಂಬಾ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫಿಕೇಶನ್ಸ್ ಮಾಡಿಸ್ಕೋಬೇಕು. ಡಯಾಬಿಟಿಸ್ ತುಂಬಾ ಹೈ ಇರೋರ್ಗು ಈ ತರ ಮಾರ್ಫಾಲಜಿ ಇಶ್ಯೂಸ್ ಇರುತ್ತೆ. ಶುಗರ್ ಕಂಟ್ರೋಲೇ ಮಾಡ್ಕೊಂಡಿರಲ್ಲ, ನಮಗ್ ಟೈಮ್ ಇಲ್ಲ, ನಮ್ಗೆ ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡಕ್ಕಾಗಲ್ಲ, ನಮ್ ಡಯಟ್ ಮಾಡಕ್ಕಾಗಲ್ಲ, ನೀವು ಬೇಕಾದ್ರೆ ಇನ್ಸುಲಿನ್ ಚುಚ್ಬಿಡಿ, ಅದು ಅವ್ರದ್ದು. ಸೊ ಅದೆಲ್ಲ ವರ್ಕ್ ಆಗಲ್ಲ. ಸ್ಪರ್ಮ್ಸ್ ಕರೆಕ್ಟ್ ಆಗಿ ಆಗ್ಬೇಕು, ಹೆಲ್ತಿ ಪ್ರೆಗ್ನೆನ್ಸೀಸ್ ಆಗ್ಬೇಕು ಅಂದ್ರೆ ಅವ್ರು ಪ್ರಾಪರ್ ಡಯಟ್ ಫಾಲೋ ಮಾಡ್ಬೇಕು, ಶುಗರ್ ಅವಾಯ್ಡ್ ಮಾಡ್ಬೇಕು, ಕರೆಕ್ಟ್ ಆಗಿ ಅವಳು ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡ್ಬೇಕು, ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ ಕಮ್ಮಿ ಮಾಡ್ಕೋಬೇಕು. ವ್ಯಾರಿಕೋಸ್ ಇಲ್ಲಿಂದ ಮಾರ್ಫಾಲಜಿ ಹಾಳಾಗ್ತಿದೆ ಅಂದ್ರೆ ವ್ಯಾರಿಕೋಸ್ ಎಫೆಕ್ಟ್ ನೆಲ್ಲ ಹೇಗೆ ನಲಿಫೈ ಮಾಡೋದು ಅಂತ ಆಂಡ್ರಾಲಜಿಸ್ಟ್ ಅವ್ರಿಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ. ಸೊ ಎಷ್ಟೊಂದು ರೀಸನ್ಸ್ ಇಂದ ಟೆರಟೋಜೂಸ್ಪರ್ಮಿಯಾ ಆಗುತ್ತೆ. ಸೊ ಅದಕ್ಕೆಲ್ಲ ಹೇಗೆ ಅದನ್ನ ನಾವು ನ್ಯೂಟ್ರಲ್ ಮಾಡ್ಬೋದು, ಹೌ ಕ್ಯಾನ್ ದ ಮಾರ್ಫಾಲಜಿ ರಿವರ್ಸ್ ಅಂದ್ಬಿಟ್ಟು ಆಂಡ್ರಾಲಜಿಸ್ಟ್ ಹೇಳ್ತಾರೆ. ಅದಾದ್ಮೇಲೆ ವಿ ಹ್ಯಾವ್ ಅ ವೆರಿ ಗುಡ್ ಆಂಡ್ರಾಲಜಿಸ್ಟ್ ಹಿಯರ್ ಇನ್ ಗರ್ಭಗುಡಿ, ಡಾಕ್ಟರ್ ಶ್ರೀನಿವಾಸ್ ಬಿವಿ ಅಂತ. ಅವರು ತುಂಬಾ ಜನಕ್ಕೆ ಈ ತರ ಸ್ಕ್ಯಾನ್ ಮಾಡಿ ಏನ್ ಮಾಡ್ಬೋದು ನೆಕ್ಸ್ಟ್, ಹೌ ಟು ರಿವರ್ಸ್ ದ ಪ್ರಾಬ್ಲಮ್ಸ್ ವಿಚ್ ಹಸ್ ಅಕರ್ಡ್, ಅದನ್ನೆಲ್ಲ ಕರೆಕ್ಟ್ ಆಗಿ ಅಡ್ವೈಸ್ ಕೊಡ್ತಾರೆ. ಆಂಟಿ ಆಕ್ಸಿಡೆಂಟ್ ಥೆರಪಿ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾರೆ, ಹಾರ್ಮೋನ್ ಇಂಜೆಕ್ಷನ್ಸ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾರೆ. ಕೌಂಟ್ ಟು ಮೊಟಿಲಿಟಿ ಎಲ್ಲ ತುಂಬಾ ಕಮ್ಮಿ ಇರೋರಿಗೆ ಯಾವ ತರ ಅದನ್ನ ಪ್ರೋಗ್ರೆಸ್ ಮಾಡಿ ಚೆನ್ನಾಗ್ ಆಗ್ಬೋದು ಅಂತ ಹೇಳ್ತಾರೆ. ಆಮೇಲೆ ಸ್ಪರ್ಮ್ ರಿಟ್ರೀವಲ್ ಅಂತೂ ಈಸ್ ದ ಬೆಸ್ಟ್ ವಾಟ್ ಐ ಹ್ಯಾವ್ ಸೀನ್. ಸೊ ಅಜೂಸ್ಪರ್ಮಿಕ್ ಪೇಷಂಟ್ಸ್ ಅಲ್ಲಂತೂ ಸ್ಪರ್ಮ್ ರಿಟ್ರೀವಲ್ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾರೆ. ಸೊ ಅದನ್ನೆಲ್ಲ ಅವ್ರ ಅಡ್ವೈಸ್ ತಗೊಂಡು ದೇ ಕ್ಯಾನ್ ಗೋ ಅಹೆಡ್ ವಿತ್ ದೇರ್ ಪ್ಲಾನ್ಸ್.
Soumya Rao has asked a question. Can you please tell what is torch test? I have had 2 miscarriages and I've been asked to go through a torch test. Should I do it? Is it worth it?
ಟಾರ್ಚ್ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಅಂದ್ಬಿಟ್ಟು ಮುಂಚೆ ನಾವು ಮಾಡ್ತಾ ಇದ್ವಿ. ಆಮೇಲೆ ಲಾಟ್ ಆಫ್ ರಿಸರ್ಚಸ್, ಲಾಟ್ ಆಫ್ ಸ್ಟಡೀಸ್ ಆದ್ಮೇಲೆ ದಿಸ್ ಇಸ್ ನಾಟ್ ಯೂಸ್ಫುಲ್ ಅಂತ ಹೇಳಿದ್ದಾರೆ ಒಪಿನಿಯನ್. ಸೊ ಟಾಕ್ಸೋಪ್ಲಾಸ್ಮಾ, ಸೈಟೋಮೆಗಲೋ ವೈರಸ್ ಅದೆಲ್ಲ ಸೇರಿ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಬೇಬಿಗೆ ಆಗ್ತಾ ಇದೆಯಾ ಅಂತ ನೋಡ್ಬಿಟ್ಟು ಇದ ಅಬಾರ್ಷನ್ ಕಾಸ್ ಅಂದ್ಬಿಟ್ಟು IgM IgG ಅಂತ ಆಂಟಿಬಾಡಿ ಟೈಟರ್ಸ್ ನೋಡ್ಬಿಟ್ಟು ಟ್ರೀಟ್ ಮಾಡ್ತಿದ್ವಿ. ಬಟ್ ಅದು ಆಬ್ಸಲ್ಯೂಟ್ ಈಗ ಬೇಕಾಗಿಲ್ಲ.
ಅದಕ್ಕೆ ಏನಾದರೂ ಫರ್ದರ್ ಕೋರ್ಸ್ ಆಫ್ ಆಕ್ಷನ್ ಅವ್ರು ಏನ್ ಮಾಡಬೇಕು?
Okay, can she send all her reports?
Okay, Soumya Rao, please send all the reports that you have, whatever reports you have, to dreams@garbhagudi.com.
Or she can meet me also.
Yeah, or we can arrange a consultation with Dr. Asha. Please reach out to our teleconference center. ಇದು AMH ಇಂಪ್ರೂವ್ ಮಾಡೋದಕ್ಕೆ ಏನಾದರೂ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ ಇದೆಯಾ ಅಂತ 2 ಕ್ವೆಶ್ಚನ್ ಇದೆ.
ಎಷ್ಟಿದೆ?
ಒಬ್ಬರದು 0.6 ಇದೆ, ಇನ್ನೊಬ್ಬರದು 1.1 ಇದೆ.
Okay, see this AMH has to be done in a standard way. Very good laboratory, because I have seen many roadside laboratories, they don't do AMH in a proper way. Okay. For example, you give blood today, they send it tomorrow or day after tomorrow to the some outsource center. Okay. Where it is done, processed. So aವಾಗ AMH ಎಲ್ಲ ಕಂಪ್ಲೀಟ್ ಆಲ್ಟರ್ ಆಗುತ್ತೆ. ಸೊ ಜನರಿಗೆ ತುಂಬಾ ಗಾಬರಿ ಆಗ್ಬಿಡುತ್ತೆ, ಏನಕ್ಕೆ ನನಗೆ 0.6 ಬಂದ್ಬಿಟ್ಟು ನನಗೆ ಇನ್ನು 25 years ಅಂತೆಲ್ಲ ಗಾಬರಿ ಪಡ್ತಾರೆ. ಸೊ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಲ್ಯಾಬ್ ಅಲ್ಲಿ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ಸ್ ಅಲ್ಲಿ ಮಾಡ್ಬೇಕದು.
AMH ಏನು ಇಂಡಿಕೇಟ್ ಮಾಡುತ್ತೆ?
ಆಂಟಿಬುಲೇರಿಯನ್ ಹಾರ್ಮೋನ್ ಅಂತ, ದಟ್ ಇಂಡಿಕೇಟ್ಸ್ ವಾಟ್ ಈಸ್ ಯುವರ್ ಓವೇರಿಯನ್ ರಿಸರ್ವ್. ಸೊ ನಿಮ್ದು ಅಂಡಕೋಶದಲ್ಲಿ ಎಷ್ಟು ಪ್ರಮಾಣ ಇದೆ ನಿಮ್ದು ಮೊಟ್ಟೆಗಳದ್ದು, ಅದರದ್ದು ಕ್ವಾಂಟಿಟಿ ಮತ್ತೆ ಕ್ವಾಲಿಟಿನ ಇಂಡೈರೆಕ್ಟ್ ಆಗಿ ಇಂಡಿಕೇಟ್ ಮಾಡುತ್ತೆ. ಸೊ ನೀವು AMH ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ನಿಮ್ದು ಓವರೀಸ್ ಹೇಗೆ ಫಂಕ್ಷನ್ ಆಗ್ತಿದೆ ಅಂತ ಯು ವಿಲ್ ಗೆಟ್ ಅ ಐಡಿಯಾ. ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇಟ್ ಶುಡ್ ಬಿ ಬಿಟ್ವೀನ್ 1.7 and 2.4, and it also depends on the age at which you are. So for example, on lady of 37 years ಅವ್ರಿಗೆ 1 no less than 1 is also normal, but 25 years ಅವ್ರಿಗೆ 0.9 0.7 ಎಲ್ಲ ನಾರ್ಮಲ್ ಅಲ್ಲ. So it has an age related graph. So ಅದು ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಒಳ್ಳೆ ಕಡೆ ಮಾಡಿಸ್ಬೇಕು, ನಿಮ್ ಏಜ್ ಏನು ಅನ್ನೋದು 2 ಫ್ಯಾಕ್ಟರ್. ಪ್ಲಸ್ ಅವ್ರು ಬಂದ್ಬಿಟ್ಟು ಡೇ 2 ಡೇ 3 ಒಂದು ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಕೊಳ್ಳೋದು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್, AMH ಕಮ್ಮಿ ಇರೋರು. ಸೊ AFC ನೋಡ್ಬಿಟ್ಟು ನಾವು AMH ನ ಕೋರಲೇಟ್ ಮಾಡ್ತೀವಿ.
ಫಾರ್ AFC ಬಗ್ಗೆ ಹೇಳಿದ್ರಿ, ಅದು ಮತ್ತೆ AMH ಜೊತೆಗೆ ನೋಡಿದ್ರೆ ಜಾಸ್ತಿ
highly sensitive ಅದು combination. For example, the lady whom you are telling 0.6, she comes and gets a day 2 day 3 scan, and the egg reserve is quite good, 5 to 6 ಅಂದ್ರೆ ಅವ್ರು ತುಂಬಾ ಆಂಕ್ಷಿಯಸ್ ಆಗೋದ್ ಬೇಕಿಲ್ಲ. ಬಟ್ ಅವ್ರು ಬಂದಾಗ ಬರೀ 1 ಇದೆ, ಈ ಕಡೆ 2 ಇದೆ ಅಂದ್ರೆ alarm bells should ring in her head.
Okay.
So she should immediately start her treatment and conceive with her own eggs.
Hmm.
Illa andre AMH 0 adaga she has to go for donor eggs alva.
Okay. Oh.
So ಅಂಥವ್ರಿಗೆ ನಾವು ಕರೆಕ್ಟ್ ಆಗಿ ಕೌನ್ಸಿಲ್ ಮಾಡ್ತೀವಿ. ಅವ್ರದ್ದು AFC, AMH, ಡೇ ಟು FSH ಎಲ್ಲ ನೋಡ್ಕೊಂಡು ಅದನ್ನ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಅನಲೈಸ್ ಮಾಡಿ ವಾಟ್ ದೇ ಶುಡ್ ಡೂ ನೆಕ್ಸ್ಟ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಯುವರ್ ಕ್ವೆಶ್ಚನ್ ವಾಸ್ ಹೌ ಟು ಇಂಪ್ರೂವ್ AMH ಅಂತ. ಸೊ ಇಫ್ ದ ಲೇಡಿ ಇಸ್ ವೆರಿ ಒಬೀಸ್, BMI ತುಂಬಾ 30 ಓವರ್ ವೆಯ್ಟ್ ಆಗ್ತಿದ್ದಾರೆ, ಒಬೆಸಿಟಿ ಕಡೆ ಹೋಗ್ತಿದೆ ಅಂದ್ರೆ ಶಿ ಹ್ಯಾಸ್ ಟು ಡಿಕ್ರೀಸ್ ಹರ್ ವೆಯ್ಟ್. ನ್ಯೂಟ್ರಿಷಿಯಸ್ ಡಯಟ್ ಕರೆಕ್ಟ್ ಆಗಿ ತಗೋಬೇಕು. ಲೇಡೀಸ್ ತುಂಬಾ ಜನ ಕರೆಕ್ಟ್ ಟೈಮಲ್ಲಿ ಊಟ ಮಾಡಲ್ಲ, ಕರೆಕ್ಟ್ ಆಗಿ ಹಣ್ಣು ತರಕಾರಿಗಳು ತಗೊಳ್ಳಲ್ಲ, ವಿಟಮಿನ್ ಸಿ ತಗೊಳ್ಳಲ್ಲ, ಮತ್ತೆ ಸನ್ಗೆ ಎಕ್ಸ್ಪೋಸ್ ಆಗಲ್ಲ, ವಿಟಮಿನ್ ಡಿ ಇರೋದೇ ಇಲ್ಲ, ತುಂಬಾ ಲೋ ವ್ಯಾಲ್ಯೂಸ್ ಇರುತ್ತೆ ಅವ್ರಿಗೆಲ್ಲ. ಸೊ ಅದೆಲ್ಲ ಸಪ್ಲಿಮೆಂಟೇಶನ್ ಕರೆಕ್ಟ್ ಆಗಿ ತಗೋಬೇಕು. DHEAS ಅಂತ ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ ಇದೆ ದಟ್ ಯೂಶಲಿ ಇಂಪ್ರೂವ್ಸ್ ದ AMH and the AFC ಸ್ಕೋರ್ ವೆರಿ ವೆಲ್. ಬಟ್ ವಿತ್ ಡಾಕ್ಟರ್ಸ್ ಅಡ್ವೈಸರ್ ತಗೋಬೇಕದು. ಹಂಗೆ ನಾವೇ ಓವರ್ ದ ಇದು ತಗೋಬಾರ್ದು ಕೌಂಟರ್ ಅಲ್ಲಿ. ಆಮೇಲೆ ನಾವು ಅವ್ರದ್ದು ಬೇರೆ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಎಲ್ಲ ನೋಡ್ಬಿಟ್ಟು ಅವ್ರದ್ದು ಕಂಪ್ಲೀಟ್ ಆಗಿ ಕೋಎನ್ಸೈಮ್ Q10 ಅವನ್ನೆಲ್ಲ ಕಾಂಬಿನೇಷನ್ ಕೊಡ್ತೀವಿ. ಒಂದು 3 drugs 60 days to 90 days ನೋಡ್ಬಿಟ್ಟು ಅವ್ರನ್ನ ವಾಪಸ್ ಕರ್ಬಿಟ್ಟು ಎಲ್ಲ ಅನಲೈಸ್ ಮಾಡ್ತೀವಿ. ದೇರ್ ಆರ್ ಮೆನಿ ಥಿಂಗ್ಸ್ ಇನ್ ದಿಸ್, ದೇ ಹ್ಯಾವ್ ಟು ಕನ್ಸಲ್ಟ್ ದ ಡಾಕ್ಟರ್.
ಅಡ್ವಾನ್ಸ್ ಟ್ರೀಟ್ಮೆಂಟ್, when should we go for advanced treatment ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಕೇಳ್ತಾ ಇದ್ದಾರೆ.
When should we go for advanced?
ಈಗ ನಾವು ಅಡ್ವಾನ್ಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ. ಸೀಕ್ವೆನ್ಷಿಯಲ್ ಟ್ರಾನ್ಸ್ಫರ್, ಎಂಬ್ರಿಯೋ ಪೂಲಿಂಗ್ ಇದೆಲ್ಲ. So when should we go for sequential transfer or any of the advanced treatment options? What is the indication for going for advanced treatment options? Endometrial regeneration or laser assisted hatching, all of these. When should we go for that? That's one of the questions.
Each one has an indication actually.
Okay.
See, for example, they've had multiple IVF failures, IVF failures antira avrige. So they could be having some genetic issues and one proper genetic analysis ಮಾಡ್ಸಿ, and we may advise PGS also.
Okay.
Or the embryos were very good, but it had a very thick layer of zona.
Okay.
And it was documented in their discharge summaries antidre. We'll tell them go for laser hatching.
Okay.
Because it will help the embryo to stick to the uterus well, because we have hatched the zona.
Okay.
Isn't it?
Yes.
And if they've had a previous baby with congenital anomalies, Down syndrome, so now they don't want to undergo that same very stressful period, they go for an embryo biopsy.
Okay.
And sometimes you have had an endometrium where it has never crossed 7 millimeters. The blood flow has never crossed more than 2/5. Then we ask them to go for endometrial regeneration. For example, they have failed in multiple IUI. Then I ask them to go for a proper laparoscopy or go for a magnetic sorter. Sometimes the husband would have given the ejaculate sample and the embryos are very bad grade. Then we advise them to go for TISA-PISA, where the oxidative stress is less, DNA damage is less, and the embryo created will be of a very good quality. She has undergone multiple day 3 transfer, but she has never conceived. Then we tell them go for a sequential or a day 5 transfer, where the blastocyst has a very good implantation potential compared to day 3 and 4.
Okay.
So there are many methods which has its own indication.
Okay. Each method is to solve a particular challenge.
Exactly.
So depending on the situation, a doctor can advise what treatment to take. What
Exactly. Yeah.
Okay. Now we have a question from Shubha Harish. My wife had 3 abortions in a span of 3 years. First one 5 months old, second one 1.5 months, third one 2 months. She is PCOD, doesn't have thyroid or is not diabetic. AMH level is not known. What is the cause? What should I do next?
Are they married in cousins?
No idea. They have not answered that, ma'am. We can assume they are not married.
Non-consanguineous.
Non-consanguineous.
So what was the scan report? Only polycystic ovaries it's written
Yeah,
there.
that is the only condition that has been.
Even PCOD can give rise to multiple abortions.
Okay.
Because of the compromised egg quality.
Okay.
Or she could be very obese, and if BMI is very high also, there could be chances of abortions. But she's not a diabetic, you told me.
She's not diabetic.
Even diabetes give rise to repeated abortions. The other one could be congenital anomalies of the uterus.
Okay.
Like septate uterus or bicornuate uterus, or some polyps or fibroids inside the uterus, which does not happen because in the proper way of negation, and it can give rise to multiple abortions.
chromosomes also play a role? ma'am, in
Definitely, because second and third month they are telling last two abortions,
this? Yes.
that will have a genetic implication.
Okay.
So we have to do a proper genetic counseling to this couple,
Okay.
take the entire family tree drawn,
Okay.
and the genetic specialist who comes here in Garbhagudi
Hmm.
will have an online consultation with them after the karyotyping comes,
Okay.
and it will be advised properly what to do next.
Okay.
But first thing is to rule out any anomalies in the uterus.
Okay. Okay. So first thing is we will need certain reports from you. Then from Shubha Harish, we may need to do karyotyping for husband and wife based on the genetic constant is needed. Scans are to be done to check the anomalies in the uterine pelvic area if there is any anomalies there. So that is the advice, Mrs. Shubha Harish. So if you can
let them not do any investigation on their own, because we give a proper prescription for
you
them.
have to get the prescription from a doctor and then go ahead and do it. We'll get back to one advanced treatment option. We hear about ERA. Yeah, what is ERA? When is it advised? Who needs it?
Yeah, very important, significant advances which has happened in the fertility field is endometrial receptivity assay.
Okay.
So we all know that we either transfer on day 3 or day 5 according to the endometrial lining and the blood flow. So in this endometrial receptivity assay we do in patients who have multiple IVF failure. So even when doing day 3 or day 5, they have been repeatedly failing with respect to implantation. So then we advise the lady of ERA.
Okay.
So they come on day 2, day 3. Then we start them on hormone replacement therapy, like we do for a frozen embryo transfer cycle. And then once the endometrium becomes properly 999, 8 millimeter, good blood flow, then we give them progesterone injection. And after 5 days, we take a sample from the endometrium and send it to the lab, genetic lab.
Okay.
Analyze the endometrium by doing a proper study of the genes, 200 plus odd genes, which is very, very necessary for nidation, implantation. And they give us a report telling that when should you transfer the embryo.
Okay.
For example, I've taken the biopsy and sent them. That day was not at all receptive for embryo. They give it as pre-receptive or post-receptive.
Okay.
So according to the report, I have to tailor make the embryo transfer for this lady, which we call it as personalized embryo transfer, PET.
Okay.
So that's a huge stride which has happened in this advanced infertility treatment. Ladies where they have failed multiple times have come to us. We have done an ERA and it shows that you should not transfer the embryo at 120 hours, which we were doing. It has to be done at 128 or 130 hours.
Okay.
Sometimes it prepones and gives us at 98 hours, 100th hour. So we'll know when to transfer and when her endometrium is most receptive to catch the embryo and get it implanted by itself.
Okay.
So we get a fair idea how to give a successful pregnancy for this lady doing this ERA. It's a very, very useful technique.
Okay. And we have a question from Mrs. Sindhu Chetty. Age is 30, AMH level 0.8. Last year, September 2020, I have undergone laparoscopic surgery for fibroids removal. I have gone through IVF, but it has failed. With the they did a third day embryo transfer. What is it that I have to do next? AMH is 0.8.
She's 30.
30.
Okay, actually we need some other informations.
Okay.
Like how many eggs were retrieved, what was the quality of the eggs, how many embryos were created, what was the grade of the embryos, and what was her endometrium when she was transferred, what was the semen sample, was it an ejaculated sample or a retrieved sample, what was the sperm morphology, what was the DFI. There are many things to know here so that we can advise her properly, because she's so anxious. And does she have any frozen embryos left in the lab, cryopreserved embryos? How can we help that to conceive again? So if she can just send us the discharge summary report, I'll go through it and I'll just talk to her once.
Okay. So Mrs. Sindhu Chetty, please send us your discharge summary of the IVF cycle that was done, along with discharge summary of the laparoscopic surgery and your husband's semen analysis reports. We'll be able to advise you, or you can come and meet our specialist in person or have a teleconsultation with our doctors. Kirti B is asking you a question, ma'am. we were told that we have unexplained infertility, as reports of my husband and myself are all normal. We have been married for 6 years and we are unable to conceive. Do I need to go for any advanced treatment?
Unexplained infertility, usually it's when we have no cause.
Okay.
In the test what we have done,
Okay.
we have not found any cause.
Okay.
So I need to know what are the tests done and what were the values which has been given.
Okay.
And sometimes no, even the thyroid TSH value of 5 and 6, they say normal. Some physicians. But according to fertility specialists, 2.5 to 3 should be the normal. And I've seen so many times when we treat that 5 TSH, they conceive normally. So there are so many hidden factors here. For example, one lady with unexplained infertility came to us. And she wanted to immediately have an IVF cycle because she didn't want to wait. Her age was more. Then we stimulated her and we retrieved her eggs. Eggs were of a very bad quality. Did not give us any good embryos. So this quality of eggs, quality of this embryos, we cannot check by the normal routine tests what we do. And what I was telling you about high DFI.
Correct.
Yeah,
Yes.
that wouldn't have been done for the husband, but the semen parameters will look normal in the normal lab.
So that would have missed the DFI.
Exactly. So when you do a computerized analysis, they give a proper nucleoprotein proportions and the morphology index and the proper DFI. So there are many other advanced tests here, which will give us an idea why this lady is not able to conceive. In spite of all these advanced tests, if she's not able to conceive, that is a true unexplained infertility. There are many causes for this unexplained infertility, which we can really go in depth and analyze them. If she can just meet me once, I'll be able to help her.
Okay. And we're coming to the end of the show. I just wanted to congratulate you and Garbhagudi for receiving the award, National Quality Achievement Awards as the best infertility treatment center in India.
Thank you
So
so
congratulations for that. Okay. Any last messages that you want to give for the end of the show, ma'am?
Yeah, this couple, usually they become very stressed, very anxious when they're not able to conceive on their own. So they have lot of doubts. They don't have clarity on many things. And they go on Googling or on social media, take all the wrong information, form all false notions. Instead, if they can approach a proper doctor, trust the doctor, sit with them, consult them properly, and that will really allay their anxiety.
Okay.
So once the mind is calm, you'll have more clarity to do proper things in a proper way. Because fear is one thing which we become obsessed with and it will completely cloud our consciousness.
Okay.
So, and I am a firm believer in holistic health. Complete body should be normal, mind should be normal, and you should have a proper mindset to go about for any treatment. And the more you trust the process, the more you trust the doctor, the results are very immensified. So if they can have a proper lifestyle, like a proper physical exercise, proper nutritious diet for themselves, have proper time for themselves, do pranayama or breathing exercise for 15 to 20 minutes, it has pranayama and breathing, no, usually makes your thoughts and emotions in a very, what do you say? Calmer, and you will become very emotionally very stable. Mind becomes very stable. I've seen that over years after my practice, and I am the most important experiment. I've subjected that to on myself. And I'm seeing that pranayama, breathing, diet, and exercise gives you lot of advantages on yourself. So if the people can do this and then adopt the fertility services too, this really helps them in having a very successful pregnancies.
So thank you, dear Dr. Asha. Thank you for giving so much clarity on a lot of questions, which is confusing a lot of people.
Yeah.
And also because of the lockdown, people are a little more anxious because they are unable to meet doctors,
Correct.
get clarity by meeting doctors. I just want to reiterate one message. Please go ahead and have your vaccination done immediately. Don't let your planning for pregnancy or fertility treatment or anything hold you back. Go ahead and get a vaccination as soon as possible. It will help you and your family a lot. That is the message that Dr. Asha has been giving over successive weeks in the program now. So don't delay your vaccination. Asha ma'am, you want to add anything on the vaccination part?
No, you have told it loud and clear.
Okay. So we're coming to the end of the program. Thank you, everyone. Thanks for your time.
Thank you so much.
Thank you, Dr. Asha. It was a pleasure talking to you.
Thank you so much.